Hello, my name is Kristen Wright. I'm a registered psychologist with Con Communications. I'm here to present to you on a topic of understanding intellectual developmental disorder today. And before I begin the presentation, I'd like to take a moment to acknowledge that we're on Treaty 6 territory, a traditional meeting grounds, gathering place, and traveling route for the Cree, Saulteaux, Blackfoot, Métis, Dene, and Nakota Sioux. We acknowledge the many First Nations, Métis, and Inuit whose footsteps have marked these lands for centuries. Um, so, um, to begin, we'll talk and cover today some key defining features of what an intellectual developmental disorder is, um, and the various ways that this disorder can present, as well as how we would address this in the classroom. So supports for teachers. Um, Hopefully we'll explain a little bit more on how this is impacting learning, behavior, and families, and as well as some strategies for inclusion in the classroom. Because intellectual developmental disorder is more common than people think. It's also an umbrella term that can be used for a heterogeneous group of conditions. And some of those conditions are medically explained and others are of unknown origin. So it's a little bit more complex to explain for lay folk or people who do not specialize in this area. So it's my pleasure to try to untangle that all for you and hopefully provide those teaching strategies and learning strategies that'll be helpful for students who may have this profile. Okay, so we'll dive right in. Um, okay, so some of the learning objectives here would be to define intellectual developmental disorder, and help you to recognize some of the characteristics and signs in your students, so that you might put students forward potentially for assessment, or even if families are not wanting formalized assessment and diagnosis, just so that you'd also recognize, hey, if this is maybe the profile that is consistent, what characteristics or what learning supports would be helpful for the student anyway. Um, Helping to understand the impact something like this can have on learning, behavior, and family life is integral. And then helping teachers to apply any practical strategies we might have that can be more generalized across intellectual developmental disorders, with the understanding that for each and every student, there is always going to be different strengths and weaknesses and differences in how we might apply a strategy. Your con team will be very helpful if you do have students with intellectual disorders, to really figure out which ones of those strategies are most integral to apply. So definitely leaning on your learning consultant and your speech and language and your OT are absolutely parts of this as well. Okay, so there we go. So what is intellectual developmental disorder? So it's the current term that we're using in psychology, based on the DSM-5, which is our diagnostic manual. It's the term that we use to describe somebody who has lower cognitive functioning or lower IQ. We used to call this an intellectual disability. So you may be more familiar with the use of the term intellectual disability. That's essentially what we mean when we refer to an intellectual developmental disorder. So it's interesting because it requires that intellect or IQ be below a certain level. However, that's not the only requirement. We also look at adaptive behavior or adaptive functioning. So adaptive behavior or adaptive functioning is things like communication, your self-care skills, your functional academics, your ability to be safe in the community, things that would affect, like if a child is more vulnerable to being taken advantage of, It would also affect social interaction skills, so they may be socially less mature than their peers. So all of those adaptive behaviors are also required to be below a certain level in order for it to be an intellectual developmental disorder. So it's not IQ alone. That's an important piece. The other piece is it's usually most often diagnosed by a psychologist, although some medical doctors will comment on things like cognitive delays. It would be unusual for a doctor to perform an IQ test or to do a formal assessment where they would be able to accurately specify the level of um, disorder, because intellectual developmental disorder could be mild, moderate, severe, and that would be difficult without a formal assessment. So the DSM-5 is recognizing that IQ is not the only factor, and this adaptive functioning or adaptive behavior is quite important. That is also why when a student is referred for assessment, say at your schools, we might give out questionnaires like the ABAS or the Adaptive Behavior Assessment Scale and have teachers and parents complete this form. That is to assess sort of that, that child's adaptive behaviors as well. So if a child, say, for example, has lower IQ, but their adaptive behaviors are within the average range, we actually would not diagnose it as an intellectual developmental disorder. So that's why that piece is really important. Um, okay, so here's a complicated graph, and it is of the normal curve, where I've superimposed different levels of functioning onto this curve. So we'll take some time to discuss what all of this is, because this appears very frequently in conversations about psychological assessments of students. So you'll notice here that the curve has an average range in the center, and that tends to be the largest portion of the curve. So we could say that the average range is wide. What that might mean is in a report, you might see things called a percentile score, percentile rank. If we were to describe this using the curve, that would mean if we took 100 students the same age as your student and lined them up in terms of different abilities, the percentile score they'd receive would be their relative place in line with respect to other students. So the average range, it's important to know with respect to that lineup, is between 25th in line and 75th in line. So that's a wide range. When we're looking at intellectual developmental disorder, we are typically looking at students who fall number 2 in line or below. So that would mean that their performance would be better than 2 out of 100 or even less in terms of students their age. And that is based on their cognitive ability or their IQ. We see plenty of students who have academic scores in that range who do not have an intellectual developmental disorder. They may have more of a specific learning disorder. So that's another talk that we have. And I would definitely refer you on to that talk if that's more of the student profile you're looking at. Where it comes to IQs that are, say, between the, say, the second percentile and maybe the 16th percentile, that's that red band called the borderline intellectual functioning range. And that's not a formal diagnosis. So that's not something you'll see in the DSM, and it's not something codable by Alberta Education. But it is something relevant when we're talking about learning, because children whose IQ falls in that range will still have challenges with reading, writing, and math. Those children may be eligible for more of a diagnosis of a specific learning disorder. So know that it's not that those children could receive no supports. It's just that those supports would look different and they would be based on different levels of intellectual ability. Um, so that's that borderline functioning band, the red one there. Where the orange band is, where we call mild intellectual disability, That would be children who have an IQ score of 70 or below. And we would say their adaptive functioning is also in that same range of below 70. Um, at times, we can kind of go up to 75, but when you're beyond 75, we're really not looking at an intellectual developmental disorder. You're probably looking more at borderline intellectual functioning. So there is a little bit of wiggle room, but not a whole lot. So mild intellectual developmental disorder would be somebody with an IQ between 55 and 70, usually. And those would be children who will learn to read eventually. They might take longer. They'll be able to write and do some basic math. They'll be able to work semi-independently as adults with some support. They may, as adults, require things like support with budgeting or driving, taking transit, dealing with landlords or dating, those kinds of more abstract tasks in adulthood would be somewhat difficult for somebody with a mild intellectual disability. So definitely somebody with this IQ range will be able to find employment. Um, they would be more jobs that involve tasks that can be overlearned and practiced a lot and don't change very much. In jobs that don't involve a whole lot of critical thinking or in the moment decision making would be good jobs for that individual to have. And in situations for someone who has a mild intellectual disability or mild intellectual developmental disorder, if obtaining work is going to be difficult for that individual, they may qualify for things like PDD or AISH, depending. So these students, as children, will very likely require accommodations to the grade level of programming. They are not likely to be students who are at grade level, and they're students who are very likely to require an IPP throughout their education and accommodations, right? You may find students, of course, in your classrooms with a mild intellectual developmental disorder. That would not be uncommon, actually. A moderate intellectual developmental disorder would be a student whose IQ is approximately below 55, so between 40 and 55. That might be less likely to come into your classroom settings because often children who have a moderate intellectual disability are diagnosed earlier, so they wouldn't be coming into your schools with no documentation or no identification of having these delays. They would usually have delays that have happened throughout their entire life, often with other medical comorbidities. So families would be aware of these kids and they would likely have other medical needs outside of just the educational needs that they have. Someone with a moderate intellectual developmental disability can acquire some more basic academics, and usually they would kind of level out or max out at sort of a grade 2 to 4 level of literacy. They will require lifelong supports without question in terms of working and living accommodations. And they should be eligible for PDD without question. So PDD's criteria is if an individual has any IQ test that has shown an IQ below 55, they are eligible for that service in adulthood. Important to know if you're a high school teacher, because they would only require one IQ test to have occurred. The person may continue to live with their family into adulthood, or they may be in semi-independent or supported living accommodations. So that's kind of what it might look like. Those caregivers would be very present in that individual's life. If not, then they would likely have a social worker or somebody else responsible for their decision making. These students in the classroom at a younger age would likely require a modified program. So they would not have been able to do any grade equivalent type of programming. They would require an IPP throughout their education. The modifications we can talk about a little bit later because we've got lots of examples of programming. This is just to give you a sense of when we're looking at IQ score, sort of what range each of these classifications will end up being. You're very unlikely to come across children with a severe intellectual developmental disorder in the classroom. And that's because most of their daily living and support is essential to be provided by a one-on-one adult, at times maybe even a nursing type support, because these children can be quite medically fragile. And they may have co-occurring things like diabetes or blindness or cerebral palsy, and other motor limitations. So it is unlikely that you will have a student in an integrated setting with a severe intellectual developmental disorder. The most common, I would say, would be a mild delay or a mild intellectual disability. So within each level of delay, we see that strengths and needs are going to vary no matter what the student. So important to note, we've got these bars here, but labels here are not going to define a student's potential. And a very motivated student with a mild delay could actually, with their strong family support, achieve high school completion or other milestones that maybe average cognitive ability students achieve quite easily. They may be able to achieve it with much more support and much more practice. I have seen students do things like get their learner's permit after many tries, right? So it's possible. I would say don't underestimate what a student can do, of course. Why does this happen? So why do intellectual developmental disorders occur even in the population? What we know is that there can be some more common medical causes, sometimes genetic causes. So things like Down syndrome. Other conditions like Fragile X or fetal alcohol spectrum disorder can cause intellectual developmental delays. Things like cerebral palsy can also do that. So at different points, once a fetus is conceived, these things can happen that might cause downstream effects of an intellectual developmental disorder. And those could be things like prenatal infections in the mother, exposure to toxins in the case of fetal alcohol, and maternal health issues. So if the mother's health was a challenge throughout the pregnancy, then that may be attributable. During birth, there are a number of things that can happen that might impact a child, such as oxygen deprivation. If the cord is wrapped too tightly around the neck and there's asphyxia happening with the child, very low birth weight or very premature infants can often be at risk for intellectual developmental disorders, among other things, of course. Childhood illnesses, injuries, trauma, all of these things can impact a child's cognitive abilities. In some cases, the reason for the intellectual developmental disorder can be entirely unknown. So it may not make sense to go on a quest to find out why something like this happened. Rather, as teachers, as parents, it may be more useful to focus on the child's current abilities and what they're going to need from the adults in their life to continue growing and to be the most successful human that they're going to be, right? So those are some things to note there. Oops. Sorry there. It just went ahead on me. In terms of the impact on learning, there we go. The impact on learning that an intellectual developmental disorder can have in a classroom setting. Lots of things can be impacted, or they may not be, because it's a heterogeneous group of kids, right? So the reason that it's happened sometimes does actually have some bearing on which aspects of learning will be impacted. So for some students, it may be more processing speed issues, where they take more time to process information and therefore will take much more time to come up with an answer. Um, this might even be noticeable in conversations with students, where they need more processing time even to come up with a verbal response in conversation. Um, this can affect abstract thinking and concepts. That's the most common, I would say, where we're talking about intellectual developmental disorder. Um, these students were going to need more concrete examples of things. Thinking in the abstract generality is not going to work so well. Figures of speech would be harder for them to understand. It does come with memory challenges for many students. So those can be working memory challenges where a student may be able to hold less information in their immediate memory. For example, when you're talking, they may only catch a certain number of words and remember a certain number before they need to either rehearse it to remember it or it's gone. Um, so things like multiple step directions for somebody who has working memory weaknesses are going to be really hard. That student is going to need a lot more supports, either visual or through repetition, to get those multi-step directions. Writing things down is one of those key memory strategies we always advocate for if the child is able to read a list or is able to read a picture chart. Those are great. Um, Children with an intellectual developmental disorder will have difficulty generalizing their learning from one context or situation to another. So it may be generalizing within two different school examples, or it could be that a child learns, for example, how to calculate something in math at school, but when they're in a store with their parents and they're trying to figure out, do I have enough money? They're not able to generalize that skill without practicing it in the scenario of being in a store. So, generalizing learning across situations is one of those things that's probably going to affect most all children with an intellectual developmental disorder. Academics are going to be harder because they're really working with a cognitive reserve that is less robust than most other students. They're less able to remember things. So if short-term memory is affected, then long-term memory will probably also be affected because it depends on that short term to enter the long term. Um, Academics are going to be challenging. Their levels of programming are very likely to differ from their peers. Learning is absolutely still possible. Learning is absolutely still the goal, right? Children with an intellectual developmental disorder continue to learn, but they learn at their own pace, and that's often and very likely slightly below their peers, right? These learners tend to be more passive. And what I mean by that is they're less likely to initiate with their learning. They're less likely to tell you as a teacher that they don't understand something. And they're less likely to put up their hand to say, I'm done, or to ask for extra help. So teachers are going to need to take a much more active role with these students in checking in and trying to ensure that they understand instructions. They don't need any questions answered before they continue with their work. Um, Most definitely, that's one of those ways that an intellectual developmental disorder can impact learning. When we look at the impact on behaviors, what can often happen is that behaviors are linked to unmet needs. And when we talk about a child with an IDD and unmet needs, it's most often the case that they're receiving work that could be beyond their ability, or they're misunderstanding the instructions completely and they're just frustrated and they don't know where to start. Um, they may appear to be more non-compliant when they're actually confused or just fully overwhelmed with all of the stimulation in the environment. They are likely to be more easily succumbing to distractions as well. Um, they may also have delays in their social understanding. So, misreading social cues in their peers, taking longer to reply in conversation, and having trouble making friends or keeping friends, often because their interests are actually less mature than their peers as well. So, it's hard to initiate a game if you don't like the same things. Um, Parents and teachers often describe children with an intellectual developmental disorder as seeming to be much less mature than their peers. That would be a very common thing to experience. These kids are more vulnerable to being taken advantage of, and they're more vulnerable to things like bullying. So having teachers have an extra ear out to make sure things like that aren't happening to them is really important. Um, they're also more likely to have co-occurring conditions. So co-occurring meaning that they have intellectual developmental delays and they also have another condition like ADHD or anxiety or autism, which will complicate the supports that that student receives or needs, and also kind of complicate the whole dynamic of figuring out how do we best support this student if we have co-occurring conditions happening at the same time, right? Um, Here, an assessment from a psychologist would be really helpful because they can kind of tease apart which of the things that are going on are more likely impacting which aspects of learning, and which goals are probably more achievable and attainable for that student in a given year. Um, Self-regulation can also be a real challenge for somebody like this who needs to be taught explicitly how to regulate it. It isn't that they'll just pick up on it on their own. And it isn't that they should be experienced or expected to self-regulate. Many of these students will require co-regulation rather than self-regulation. And that phase of co-regulation may extend beyond actually what we would usually see in typical development, because those critical thinking skills and that, hey, I can apply this strategy, that thought might not occur as much. So they may need a lot more guidance and explicit teaching from adults before that adult can step back and expect that regulation can be done independently. Um, and that goes along with the characteristic of being a more passive learner, is that they require much more explicit support from teachers to regulate and for understanding all of these pieces, right? Are they frustrated because they didn't sleep, or are they frustrated because this work is too hard? Lots of different reasons, right? Having intellectual developmental disorder does have an impact on family life, absolutely. It creates more stressors in families around caregiving because they're often managing extra appointments for that child relating to health or therapies or just advocacy in general. Um, it can create financial strains on families relating to medical needs or even assistive technology needs or things that the child needs that, for example, another child may not. Um, Future planning can also be a source of that financial stress, where if a family anticipates that the person might not be able to have a job as an adult or be able to live on their own as an adult, the family may be needing to allocate funds for that, or have a plan for that, which can be stressful. Understandably, navigating health systems and educational systems and all the systems that are going to be interwoven in this individual's life is going to be more challenging, and it's going to require a lot more from that family. So don't underestimate the stressors that a family might be experiencing as a result of having a child with a special need or a special education need. Um, and understanding that in some families, genetic markers for intellectual developmental disorder may be inherited. And so parents may actually have difficulties themselves. And as teachers, they may, when you're meeting with parents, you might ask parents about what is going to be most helpful for them in meetings around receiving the information, whether it's written form, whether it's recapping and repeating the main goals, or slowing down your rate of speaking, because sometimes it's just about processing things and taking a little more time. Have those understandings for families as well. Families who are overwhelmed in general will probably need us to slow down a bit. And I know that sometimes we may speak more quickly or use language that's specific to our professions, where a layperson or a family member might not understand. Most definitely, we're looking at sometimes there is more of an emotional toll as well on families because of all of these stressors. We're also looking at families who have more extended partnerships with agencies and communities. So they're juggling a lot. Just understanding that side of that as teachers is going to be very helpful when we're, setting expectations and speaking with families. Absolutely. So there are some principles of inclusive education that cut across any challenge that any child could have, where all children deserve a feeling of belonging in the space that they are attending for their school. So inclusion and belonging is not just about being placed in an inclusive classroom setting. It's about that student having active participation and active involvement in the whole class. It may be that that participation involves modification or adaptation to the curriculum, and that's okay. Accommodations are usually given if a child has an intellectual developmental disorder. We want all students to feel a sense of achievement, and that's why we would accommodate things. It's not about giving one student an upper hand or an unfair advantage. It's about leveling the playing field so that every student can feel like they have the ability to achieve, right? Support can mean a variety of things for students. It could involve one-on-one support. It could involve pull-out support. It could be small groups. It could be accommodations for testing or just reducing the sheer volume and amount of work a child has to do, understanding that the work is going to take them longer to do it, or modified expectations in general for that student. So we'll talk and spend some more time around these terms because I find there is always confusion around what is meant by modification of a curriculum, adaptation, and accommodation. And all of these things can happen for the same child at different times, right? So modifying a child's program or learning would be learning outcomes that are significantly different from Alberta Ed curriculum. So it's not that a grade 4 student can achieve all of the grade 2 learning outcomes. These would be students who really are scattered in their profile, and we're really individualizing things a lot. So on the report cards for a student who's on a modified program, there may be no grade or mark provided, and the student might be identified as not of graded curriculum or NGC. Progress reports would still describe those learning goals and those outcomes that they achieved, but it wouldn't be with respect to, say, the typical grade 2 curriculum. Because you would probably, in the area of modification, you would be doing some life skills training, or it'd be maybe more of a life skills curriculum. A student on a modified program is likely to be, say, a student with a moderate intellectual developmental disorder is going to require modification. It's not going to be enough just to adapt, very likely. Because adaptation would be a change in the grade level of programming. So, for example, if a student is in grade 4, but they're being evaluated and programmed at a grade 2 level, that's an adaptation. You're taking the grade 2 curriculum and you're applying that to the grade 4 student, and you're evaluating them according to what the outcomes for grade 2 would be. And there we would, on a report card, just state the grade level of programming, and the child would receive a grade for that curriculum. An accommodation is maintaining a grade level of programming, but providing lots of support, such as a reader, or a scribe, or extra time, or access to a word processor with spell check. These kind of accommodations would be made, but the student would still be graded according to their grade level curriculum. So those are some differences. It seems like it's all clear here until we meet students. And then we think, is that a modification or an adaptation? And with an adaptation, we would still often see accommodations in place, because many students with intellectual developmental disorder require accommodation. So an example of modification would be a grade 4 student with a moderate intellectual developmental disorder who's receiving one-on-one support to work on self-care skills or phonemic awareness, as well as counting with one-to-one correspondence. So this is a student you can see that would be significantly behind what a grade 4 student would typically be. So the grade level of programming there would not be reported on the report card. And those various goals that you would have on their IPP would be the things that you're actually commenting on in terms of their progress. A student who has an adapted curriculum would be, say, a grade 4 student with a mild intellectual developmental disorder, who's learning and being evaluated at a grade 2 level, even though they're programmed in a grade 4 classroom. So their English language arts would be evaluated at grade 2, and so would their math. They would also receive accommodations such as a reader and a scribe or additional time, and they'd receive some small group support or some pull-out support for reading and math. And on their report card, you would have their grade level of programming as a grade 2 level, right? And I would say adaptation would be very common for a child with a mild intellectual developmental disorder. A moderate intellectual developmental disorder is going to require probably more modification and life skills type programming. Accommodations would exist across those two programs, right? So you could see a grade 4 student, for example, who has a specific learning disorder. So that may not necessarily be a difference in IQ, but their reading is very challenging. They might still be evaluated at a grade 4 level, but that evaluation would happen with the use of a reader and scribe. They would get to use spell checker, for example, or get additional time on tests. And maybe in class assignments where you can't really give additional time, they would have a reduced number of questions to complete. We wouldn't be changing the level of the work for that student. We would be changing how we're evaluating that student and the supports we're using to help them learn and be evaluated. So their grade level of programming would stay grade 4 on their report card. Here, some of these practical strategies, because it sounds like we're getting to the point where we're thinking, okay, I understand what an intellectual developmental disorder could look like. And that there are changes that are going to need to be happening for those kids' programming. But what are those practical strategies that are needed to help that child learn? I would say big ones are really clear language, reducing the amount that we're saying, making it simple and clear. So if you're using a lot of jokes and non-literal language like sarcasm or figures of speech, that's going to be much harder for that child to understand. And they may laugh and appear to be following along with the joke, but they might also think to themselves and feel totally out of place and totally excluded because they don't actually understand. So definitely using very clear language helps. Repeating your instructions will also very much help. The use of visuals. So anytime you can use a picture or a diagram, even a quick sketch on your whiteboard to show, hey, if I'm going to make a pie chart, this is what it would look like. Um, any diagram alongside a verbal instruction is going to be helpful for that child to retain, but also if they forget, then they can look up and quickly rejog their memory. Um, Breaking things down more into steps will be very helpful because these are learners that are not going to get the multi-step instruction. They're going to do step one and probably forget what the next steps are. So having the class do steps, like one step at a time together, will be helpful for your learners who are struggling with intellectual developmental delays. Um, Visual schedules will also be helpful when we talk about visuals for that student to know what they're doing right now and what is coming up next. Um, when we're teaching, we're wanting to chunk things into smaller little mini lessons. So think about chunking the information that you're going to be delivering to the class, and maybe do a smaller chunk with some practice and then a smaller chunk and some practice, rather than having that attention span or requirement be all of the information at once. Anything we can do to make the learning more tangible for students, using manipulatives like or little figurines or real life examples, that's going to be helpful because if you can connect it to a real life problem, then all of a sudden the reason why we have to learn something becomes much more relevant to that student. Using predictable routines is going to be key because that's how the student is going to feel secure and that they know what's going on in the classroom. They know what's coming next. Um, Even if it's a predictable routine in that every time we learn phonics, for example, it starts with these components, it ends with these components, so that they will within a lesson understand this is a predictable thing that's going to happen. Giving feedback to these students that's more immediate. So they're not practicing doing something incorrectly before they're receiving feedback will be helpful. In general, students with an IDD are going to require lots and lots more practice. So if we think of a neurotypical student as needing practice of a concept, say 3 or 4 times before they remember it, a student with IDD will probably need 10 or more times practice before they remember it. And they will probably also need frequent review. So once they've learned something, to review it every month or two. Because the retention long term of some of these concepts, even if they learned it a few months ago, may not actually be there. So we're promoting retention by doing little distributed reviews of things that they have already learned. On the practical side, related to social skills, because we know that students with IDD will be socially less mature and they might have trouble keeping up. There's also some social isolation that comes as that student becomes aware of their differences. There are peer buddy programs that, as schools are kind of delving into this area, they may be interested to look up or be in contact with. One of the ones that I know of is called the Best Buddies program, and that's an international program that's run in schools across, well, North America, where it would look to pair up students with developmental delays with neurotypical students as friends, and doing social things together. It really fosters some inclusion and understanding among the peers as well of what kinds of things maybe their friend might need as different. Other programs, and one of them that's offered through Con Communications is the Chatter program. And that is a social skills program that will explicitly teach students some of these skills and then give them opportunity to practice with peers. So if you have a student with an intellectual developmental disorder and they have the option of participating in the chatter program, that might be a good match. And I would say definitely talk to Con about having them enrolled as well. Um, Many teachers are now aware of some social thinking curriculums, with Michelle Garcia Winner being the lead author there. Schools have access to some of this programming, and the language used in social thinking can sometimes be helpful for the whole classroom. So where a student with intellectual developmental disorder might be, say, the target students of this teaching, the whole class benefits from learning social thinking. So if it makes sense to introduce into some of your elementary classrooms, most definitely I would say that's a great resource. And again, you can talk to your clinicians about implementation of this if that's something that you're also looking to do in your classrooms. Um, mhm. Some practical strategies for regulation. Many classrooms are using the Zones of Regulation program. And I would say that's an excellent program for all students to learn about their own internal sensations and how it looks on the outside to somebody else when they are, say, feeling in the blue zone or feeling in the green zone. I would point out absolutely some of those blue and green zones because I do find that sometimes when zones of regulation is applied, there can be an emphasis on that yellow and red zone as being the ones that are the real targets for intervention, whereas actually the blue zone and being kind of under aroused and having difficulty focusing, that can also be a target for intervention in the classroom. Like, what do we need to do to bring ourselves back into the green zone if we're feeling like we have no energy? Calm spaces within schools are a great strategy for regulation. Having a safe spot for that student to go if it's in the classroom, or it might even be visiting a particular safe person within the school. Like, I'm going to go for a walk and go see Mr. So-and-so and bring in the attendants, or I'm going to go for a walk and bring him this message from the teacher. Sometimes those little breaks and visits to calming people can help with that regulation and resetting a student. Um, Big ones are really regulation is often tied to whether the program is appropriately difficult for a student. If it's too difficult, you are also going to see some regulation challenges. So knowing about intellectual developmental delays in children will help with regulation because as teachers, then you'll know, okay, this is how I'm going to present work and this is the level that they're at. So we're not overwhelming the student. Staying positive with all students, I would say, and celebrating each student's individual successes. Every student, including those with IDDs, are going to have successes. They're going to make progress, and pointing that out and keeping students' motivation and their spirits bright is really actually going to be quite helpful for overall regulation and confidence building in these students. And really what we're looking for is to have collaboration and support with the whole special education team. So that's classroom teachers, that's your special education coordinator, that might be specialist services like from people like Con. That could also be external programs and services that the family is connected to and receiving help from. Um, Understanding that, of course, parents also know their child best, um, and treating parents as partners in this education journey with their child. So parents may have different goals than teachers relating to IPPs, but honoring those goals because parents also are seeing a different view of their child and some of the needs that they might have. Um, Specialists are going to bring valuable insights into how we might further adapt programming or what accommodations might be helpful. Definitely include them in planning. Attending any professional development can also be really helpful to learning new things, like learning new programs that might support regulation or learning new programs that might support social skills. All of these little areas that we might zero in on with professional development. Think about students with IDD if you have them in your class, and hey, how would that apply to this student? That's a really great strategy as educators to get into, so that when you're in those trainings, you can ask those questions. Hey, if I have students with special education needs, how could I adapt this program? And that'll be probably questions that other teachers wish that they had asked. Um, Relating to some of the key takeaways of this presentation, we want to honor and acknowledge that each student's abilities is going to vary. So students with intellectual developmental delays are not uniform, right? We know that there's different levels of like mild, moderate, severe delays, but even within those categories, each child's ability is going to vary. Talking to your team, if you have questions about those strengths and weaknesses, will be very helpful. What we know is that inclusion of all students does work. It is not easy, especially within this educational climate, to do, but inclusion will benefit all students. So even peers who are watching somebody struggle and really power through and be resilient, that's going to be inspiring to your other classmates, and that student's classmates will then develop a respect for the student who is struggling. Collaboration is going to matter with your teachers, with parents, with special ed specialists, with outside agencies if they're involved. Most definitely bringing everybody to the table is the best way forward with students who have more specific needs like this. And knowing that even a small change to your classroom or your setup or the way that you deliver instruction or the way that you adjust accommodations, all these small changes are going to make a difference. You may not think that that's the case, but knowing that it's better to make a small change now than to, redo your entire program, right? We can work with small changes and little adjustments, and those can be transformative for a student too. So no, it's not about totally reinventing things for your students. There are some key resources around common learning characteristics of children with IDD, and that'll be available to you as well as a handout part of this presentation. That in the next slide here, when you fill out or email workshop@conservices, what you would do is email them to receive a link for a short survey about this talk. And with that, you'll receive the slides from this presentation as well as the handout relating to some of those supports for different intellectual developmental disorders in the classroom. And some of those learning supports that we talked about. If there is a resource list, I will also include that there in the email that goes back to you. So thank you all for joining this talk, and hopefully it's provided you with a nice overview about students with intellectual developmental disorders and how to best support them in the classroom. And we'll look forward to seeing you soon.